every now and then you get to have the person you really, really, really want on your podcast. And Dr. Davin Lim, I am so thrilled to have you on Ageless by Rescu podcast today. Welcome.
Thank you. I thought you'll never ask, but yeah, I think it reached out before we had a DM, but then look, I really get lost in my DMs, but happy to be here. It's a pleasure.
We've got so much to talk about. And I think there's something really funny about, a Chinese Malaysian doctor speaking to an Iranian born in France, a publisher about the subject of diversity in aesthetics. I came across a piece of research from Allergan, and the research is called The Spectra of Beauty, which I loved it. It sounded really cute. But the reason it caught my attention is that they did a study with 2,500 Australians on how they see the aesthetic industry treating diversity, whether that be age or sex or ethnicity. And there were some interesting things in there. And I'm curious because of your cultural background and my cultural background, we weren't represented very well 20 years ago.
Sorry, what was the question again?
I said we weren't represented well 20 years ago. Chinese, Malaysian models were not featured in aesthetic commercials or pictures. Certainly, it's a new thing to have more Middle Eastern faces or more Indian or Asian faces in not only in advertising, but even in, clinical demonstrations and trial teams. What do you think? Have you seen the change in the industry?
Absolutely. Like you say, even in TV commercials, right? When you watch even insurance, you'll I always say, oh, there you go, there's the token Asian. So it's like, I think Australia is a multicultural society now. When you look back, like I said, even 20 years ago, the ethnics are really underrepresented. But now I think any industry probably has to acknowledge the cultural diversity, and it's in their interest to actually represent who we are. And it's I guess it's weird because when they actually talk about, so I read that study as well about diversity, and this is my take on things. Even when you come to simple things like skin color, one of the biggest differences I see is that Asians want to be white and Caucasians want to be dark. And when you look at,
and they still want this. So it's exactly the same conversation in 2022 as it was in 1981 when I immigrated as a dark-haired, dark-eyed girl who wanted to be blonde.
To be blonde, exactly. So when you look at Asians now, I think I read that article as well, and then I'm thinking, man, it's like I see it a little bit differently. I see there's a change in who I guess the minority want to portray as being part of the majority. So I understand. And and part of that report, I remember part of that report where there was some very, very low figures, and I'm pretty sure it's somewhere like 15 or 18% of ethnicities embrace their actual, it's important for them to actually embrace their ethnicities. And when I look at that figure, I think it's pretty damn low. I think,
but it's honest.
Yeah, it's honest, yeah, but I think it's really, really low. It's very low. And I guess that's part of the research where I'm struggling and go, it is, we want to be diverse, but then like you mentioned, they try to homogenize beauty, right? And that's where I think I struggle to understand the younger generation, especially.
So I'll just share some of the stats that I've read from this report because I think it's interesting. They were saying 73% of Gen Z, which is 18 to 39-year-olds, really want to change the way that they look, and they have a relationship with aging and aesthetics, that they want to look younger, they want less wrinkles, they want to look good. 62% of Gen X, which is 40 to 59, which is where I fall, and I assume you fall. Are you? Yep. Yeah. So 62 of us want that as well. But it's interesting, in the baby boomers, it's only 44%. And then to your point about this homogenization of beauty, on the one hand, where, holding accountable companies and brands and media messaging to show diversity, to show the population as it is. But consumers, from what I can see, respond to very narrow ideals of beauty. Now, I publish a magazine, I publish a podcast, I have a website, I've been a publisher for over 14 years. I have online courses where I put, I think, 12 different ethnicities just in my beauty course, the course that we did online for makeup. But at the end of the day, the articles when we publish on celebrities, there are certain celebrities that people want to look more like, and they're not a diverse group. More people want to look like a narrow group of celebrities. And to me, that's a homogenization of a beauty ideal. You know, I can come to you as a patient and say, you know, I was born with an ethnic nose. Can you inject filler into it to smooth out the bump? Or I've got a hereditary hollowness or dark pigmentation under my eyes. What can you do to make me look more Caucasian? Because maybe that's not a genetic trait of, you know, a Scandi or a Caucasian person. So, and similarly, you know, when we saw with the surgery of the Kardashianization of aesthetics, I always say, you know, who the hell wanted a bubble butt? This is a homogenization. It's funneling us into a beauty ideal that we kind of didn't know we wanted. Now suddenly it's what we're all striving for.
And I think, you know, social media, I guess with the prevalence of social media, when you look at Instagram, when you look on YouTube and look at the presenters, I can see where the industry is heading, because we're just saturated with that. Like if you go to your feed, you know, your Instagram feed, you'll see basically the same faces, especially when it comes to, like you say, influential people either in Hollywood or their TikTok. I guess I wouldn't say Hollywood now. I mean, look at your Instagram and TikTok. They're so much more influential than what Hollywood could be. And it's these filtered images, I think it's filtered images out there as well, that probably portrays what people, well, ideally want to look like. So like you mentioned, you know, when it comes to the high cheekbones, the counter argument is that there are certain, and I'm guilty of this as well, is we follow the ideal aesthetics when it comes to, you know, lip ratios, when it comes to, you know, jawline angles and all. And that's embedded in, I guess, part of our training as well, saying this is the ideal ratio. So when a patient walks in, you know, the esthetician, the dermatologist, the nurse injector, we're all there ingrained in this beauty spectrum and that narrow spectrum of what is proportionate.
And is that the Fibonacci, the golden ratio? Is that what you're trained in, or is there a different thing that we're, you know, the non-doctors, the non-aesthetic practitioners don't know about? That when you look at our faces, you're going, gosh, you know, Baha's temples are too wide and her lips need to be pumped up. You know, I mean, I'm curious, what's your measure and what are you trained in?
Yeah, I think all of us have that idea of, you know, proportionate, upper third, middle third, lower third, all that sort of stuff, and we know the angles and all. But then I think, and we do follow that to a certain degree, because that does make someone a more aesthetically ideal, whether it be cultural or non-cultural. But then it comes to that stage as well where some people can pull it off with that ratio, and some people you just can't, just because, for example, they're you know, for example, their jawline is just not enough there, or too much, and you just don't want, or too broad, and you can't, and it's mainly bone and not muscle. So I think there's the ideal aesthetics, but then also understand, for me, I also want to embrace the actual culture of that person as well. So, you know, for example, yeah, classically for Asians, yeah, I want a particular look that also empowers them culturally. So, for example, the medial cheeks in Asians may be a little bit deflated or hyperplastic. In other words, they're bone to begin with. Flatter. It's not projected. And for me, that's a nice trait. But obviously, if someone's super flat, that's different. But then it's a nice trait to have. And I may actually just, I guess, decrease that flatness a little bit, give them a little bit more projection, but not there to actually change their face at all. So I think it's very important that we embrace our actual culture as well. But then if there's little things that can be corrected or tweaked, I don't mind doing that.
So going back to this study, which says that, you know, consumers felt that the beauty industry was really pitching everything to a Caucasian woman. And, you know, we all agree that the Australian population is certainly way more diverse than we give it credit for. And that people feel confident, and it reinforces self-worth and belonging when they see someone similar to themselves in advertising, in, you know, ideals of beauty. And yet we have, countering that, the homogenization of beauty, which is occurring through, you were absolutely right, social media. There are more stars and more powerful influencers on social media than in Hollywood. They're actually reaching more people. So as a clinician, as a doctor, and, you know, you've got a huge social media influence and presence, definitely more so than I would say, you know, most doctors in Australia. When someone comes to you and perhaps you sense a distorted sense of cultural identity or a distorted sense of a beauty ideal, do you feel it's your job as part of the consultation to help them come back to who they are and help them fall in love with their own unique, you know, blueprint?
Yes, I mean, that's a good question. I actually start before the consultation. So when you look at my social media and you look at even, you know, basically what I portray, it's never about, you know, me giving, for example, XXL lips. Yeah, so it's not, or BBLs or what have you. So I kind of portray what I think is me, and what I think is, you know, aesthetically pleasing, whether it be fillers, laser, surgical, whatever. So for me, it starts even before they come to see me, because that's who I portray myself. In the context of your question, yes, I do. I actually, you know, for example, classically, even before we go to cultural, even things like lips, for example, I'm very uncomfortable giving big lips. That people might look at that and go, wow, that's really good, that's really nice. But I won't do that. That's why you don't see that in my social media. And all the stuff which I think is not aesthetically pleasing, I do not portray myself. And that's it. And for the patient coming in, hopefully they might see my profile and go, well, you know, Davin's not the guy that's going to give me 1 mil of the upper lip and 1 mil of the lower lip and make me look like a duck, because I don't. But for the patient coming in, it's very hard, because I do see on a daily basis, and it's about treading lightly as well, because the last thing I want to do is make them feel insecure or that they've had a bad decision. So when someone comes in and they've got something where it's not, you know, either culturally or even aesthetically pleasing for that individual, I tend not to make that comment. The way I see it, especially when it comes to injectables, this is all the trends, much like a haircut, like, you know, Kylie Minogue with the thin plucked eyebrows, arched in the
That's right, yeah.
yeah. So I think all of this, it's much like, it's like everything else. It's just a trend, and hopefully I'm pretty sure that in the next couple of years you'll have more. In fact, I think it's happening now. You're going to have people there with more natural looks rather than actually, you know, super high chipmunk cheeks or you know, or trout pouts.
What was interesting to me is when you look at 73% of Gen Z, 18 to 39-year-olds, that's a really broad definition of age, because a 39-year-old has literally zero resemblance to an 18-year-old. So the fact that they get lumped in as a cohort is really bizarre to me. But let's just say Gen Z are interested in aesthetics. What I think is interesting. So, you know, we're talking about diversity in terms of age there. What's the difference in your clinical practice and in your, you know, as you've seen people come through between men and women? You know, statistically, there's data showing that more and more men are interested in aesthetic treatment. So they're having their injectables, they're having lasers, they're having fillers and surgery even. Are you seeing that in your clinical practice?
Yes, I am. I guess and to be frank, I think this two, when we talk about men, there's, I guess, the, gay and then straight. I'm just going to segregate that because uh, I think the aesthetics as well is probably different in regards to sexuality. So usually, so most of my clients are straight men, right? And when it comes to aesthetics, I think they are a lot more conservative compared to women.
And is the goal for these, let's just say straight men, is the goal for them to look younger and refreshed rather than hot?
Yeah, I think the image I portray is that I will give guys what I think is an ideal treatment. So I'm not there to efface all your wrinkles. That's not me. That's not what I do. I'm there to make a bloke. That's why part of my Instagram is bloke XY, because I'm actually a blokey bloke, which means someone that comes in, I'm not gonna. It's just that thing in me where I want someone to be masculine but have their features soften a bit, and that's it. So I feel uncomfortable if someone comes in and wants stuff which I just do not gel with. So would I want them as a patient knowing that I'm performing something which I'm uncomfortable with? The answer is that I don't want that. Right. So I pick and choose my patients. I educate them well, and I give them what I think is a aesthetic outcome, which is pleasing in the context of their age.
So in the context of what you've just said, where you as a practitioner are screening the match between yourself and a patient, so that, I've spoken to Dr. Kara before. I know she was on the panel with Allergan as well. And, one of her big things is, a really long consultation, because a long consultation is going to prevent the, cognitive dissonance between what you think you want to end up looking like and what you actually can look like. So you're saying you screen your patients for that good fit. Would your advice be also, I guess, the converse of that? So, if you are, say, a baby boomer who's a little bit more conservative, or if you are, for example, looking for something that's a little bit more progressive and trend driven in your aesthetic treatment, would you look for a doctor that in their work, their social media, and the conversations that they're having is a better fit to what your end goal is?
Yep, 100%. And that's why, when people ask me, "Oh, Dad, why do you have so much in social media? You take a lot of time and effort with that." I'm trying to make my whole life frigging easier, and portray who I actually am as a doctor and what kind of results I give. So, and I guess when you look at social media, you can see the different trends. You can see the different doctors and different nurses that give different profiles. And I think it's good because everyone has a particular role. Everyone, it's just like I always say, I'm like a hairdresser. I just basically, if you suit my style, stick with me. If you don't suit my style, that's okay. You can go somewhere else. So and I think that's very important, because at the end of the day, when I finish work or even look at what I've done, you've got to feel good about yourself and go, cool, this is really me giving this, not me being just someone can push the buttons and actually churn out something. So I think it's very important to portray who you are as a practitioner.
Do you think it's problematic that the age range for people who are having hardcore aesthetic treatment and spending a lot of money, because the spend creep, and I noticed in the report as well, is really getting up there. It was quite a significant portion of the population that spend over $200 a month on aesthetics. That's a lot for most household budgets. If you really think about it, that is a lot. 10 years ago, it would be quite luxurious if you got your nails done, or if you went out and had a blow dry, you probably would do it for special events. But it's not uncommon for people to have a lot of grooming, and if you're getting injectables, that's every 3 months. And if you're getting lasers, that's every 3 months or 6 months. So, people's budget on aesthetics is really stretching. Are you finding it alarming that, it's starting now in the early 20s rather than the mid 30s?
Yeah, so I guess there's 2 points with that. First, a lot of the spend, I think at least half the spend would be on skincare, right? And
Yes.
when I look at skincare, it's just, and I divide it into two. First of all, if it makes you feel good, and secondly, does it do anything? So I think nowadays, especially with this COVID stuff, a lot of people are treating themselves to feel good. So they might be spending a lot of money, like you say, $200 per month, but maybe out of that, $100, even more, will be in feel-good treatments. So you can use that feel-good treatment. Is it like going to a movie, or is it like having, a nice dinner? Certainly by using skincare where you have self-gratification and go, well, you know what, that feels good. I'm doing something for myself. And I think that's okay, yeah, because it's not, it's not every single thing that you do for yourself, especially when it comes to aesthetic, might not be the thing which changes you, but you may actually feel really good about it.
Can I tell, sorry to interrupt you. You raised something for me that I don't know if I agree with you, because I thought to myself, those crazy multi-serum, multi-layered routines that cropped up over COVID and the lockdowns, to me, it felt like the eating disorder of the skin. It was a hyper grooming event that was happening. And it went beyond self-care. It became a form, to me, a form of controlling your environment, controlling something, fetishizing an ideal skin, dolphin skin, jelly skin, whatever skin. And to me, it started to get a little bit crazy and obsessive. And I'm a 48-year-old woman who's from the industry, and I know the levers that a company can pull to stimulate my desire to be and look a certain way. And I was triple cleansing at one point. I thought, what the hell for? I haven't left the house in like 2 months. Why am I triple cleansing? But it was a form of control. It was something that I became quite obsessive about. And everyone I spoke to your point, was like doing hyper self-care.
Yeah. Look, I think you've got a point there, but I think that's the fact. Yeah. And I guess you've got insight because you can go, holy shit, I'm cleansing my face 3 times a day. There must be something wrong. But then when you look at the other side, it's maybe someone has got not as much insight as you, and they're doing that because they actually feel good about it. And I think that's okay. So I guess the more mature I am as a dermatologist, when we're looking at skincare and go, oh, that's crap, that doesn't work, and why do people actually buy it or fall for it? Then I look back and go, hey, you know what? It's because people buy it not because it does stuff. It's because they feel good about it, and that's I think accounts for probably about 95% of skincare, because 95% of skincare is crap, and the 5% that actually works.
In your practice, do you prescribe skincare? Is that part of what you do in your dermatology? And I know that you have, a clinical practice that's a lot of pampering treatments as well as clinical treatments.
So the answer to that question, most of the time I'm actually pulling out skincare rather than prescribing, because most patients that come to see me, generally speaking, will have pigment issues or rosacea or melasma, what have you, and they're using just too much crap out there. So in the end, I'm actually pairing out the skincare, and especially for sensitive skin, because I've got to say, hey, stop everything, just use a banal, moisturizer and a cleanser, and then build up from there. So I'm a really shit salesman, so I don't like to go there with, you got to buy this cleanser, toner, day cream, eye cream, night cream, all that sort of stuff. I just go keep it simple. I'm an old school derm from that point of view. So the answer to your question is that I don't usually promote skincare in that context. So even for patients who undergo resurfacing, we turn back time and the skin looks awesome. I'll say, look, let's start with a retinol, see how you go over the next 6 months, and then gradually add stuff in. But I know, basically there's a lot of sales out there that promote a whole range, but that's not, I don't do that.
I think that's really interesting because, further to your point, you're trying to find clients and patients that gel with your aesthetic and also with your, I guess, philosophy of rejuvenation and aging well. And then you're also helping them navigate, you know, the difference between a feel-good skincare routine and an efficacious, safe skincare routine. And, you know, when you are talking about a generation or a cohort that are using things possibly before they need to, they do need to be guided alongside that. You know, I have an 11-year-old daughter who absolutely understands skincare. She has her own profile at Mecca. She uses cosmeceutical grade vitamin B serum. She knows, you know, she's educated and interested in preventing acne, which is a whole other topic that I want to get into with you. You know, but that's an 11-year-old. You know, if I was lucky, I had an Avon catalog in my room and I was ordering, you know, I was ordering some feel good skincare that made me feel like I was sophisticated.
Yeah, I guess times are changing, eh?
Do you get parents bringing in younger, you know, teens and even preteen patients for you to see because they've already started to feel not the pressure, but the interest in looking after their skin, looking younger, looking a certain way?
Yes, I think that's refreshing because I mean, at least 2, 3 times a week, I'll have this, you know, the middle-aged woman comes in with their daughter, and the daughter comes in because she's interested in skincare, and chances are, you know, if they're 12, 13, 14, 15, what have you, they're on social medias, but chances are they probably follow me and then understand my philosophy. So for me, it's actually really refreshing because they come in and they go, oh, cool, you're just going to prescribe some retinol to my mum. That's great. You know, you're not going to go like buy the whole freaking catalog. And then when I hear that, and then they'll be so empowered and so knowledgeable to go, wow, you know, we're going to start one thing at a time. And I told mum to use the sunscreen, and I told her she needs to use it twice a day. And I told her like what you said on Instagram, that she needs to use 2.5 to 3 mils of sunscreen. When I listen to that, I'm thinking, man, I feel pretty good because my message is getting out there.
Absolutely. And to be fair, I'm going to have links and everything to your social media. It is the most educational, fantastic resource. I go on there to sense check things all the time. It's such a great, and you pick one topic and you deep dive, and you know, you're not pushing it for any reason other than to educate and kind of sort out and do a bit of myth busting. So you're right. It is exciting. Like when my daughter comes to me and she understands why she's using vitamin B, it's like, oh, okay, great.
So I think for me that really resonates. You know, I guess the sole purpose why I do stuff. And yeah, it's flattering that you know, the kids follow me and and understand my philosophy, and that rubs off on the parents, which is cool.
Dr. Lim, if you were going to give advice to, you know, the heavy uptake, the Gen Z who are really doing the most uptake on aesthetic treatment, and, you know, going back to the point of diversity, what would be your advice to them in terms of starting and managing their aesthetic journey for the best possible results?
Well, I guess, like I said, there's two things: whether they want to feel good about the stuff they do at home to upkeep, and in that way, you know, spend money on a simple skincare routine. The worst thing that someone can do is actually spend a lot of money and get worse skin, but that happens really commonly because people just buy too much and use too much. So for me, you know, my best advice is, you know, start simple, and it's always procedures over skincare. So when I mean procedures, it doesn't have to be a big laser resurfacing procedure. It can be something as simple as a chemical peel, right? And like a salicylic acid peel, if you have lots of acne, that can be a really, really good thing. And then someone who's, you know, in their mid-30s, they don't have to spend big to get a laser procedure that, you know, costs a couple of $100, but then that will do so much more than skincare. So always, it's much like my you know, my social media feeds, I always say be precise as to what you want. Don't buy a whole heap of stuff, try a whole heap of crap. Just be precise. If you've got a problem, come up with a solution. And the solution sometimes is super easy. Sometimes the solution is not using too much skincare. Your skin will be better off for it. Patients with rosacea, patients with sensitive skin, you don't have to put in, heaps of vitamin C, your retinol, your retinoids, because you'll end up worse than what you have. So I guess for me, it's just be precise. Sometimes when it comes to difficult cases like sensitive skin, you do need some help. Go see your dermatologist, spend that, $250, but then your skin will actually be much better off if you listen to them, much better off compared to you trying a lot of stuff and getting a worse outcome.
I totally agree with you. And I think the difference that makes the difference is always expert advice. It's always finding, exactly as you said, the specific solution for your specific concern, not for your friend's concern, not for your mum's concern, but for your specific concern. Dr. Lim, I really am going to insist on having you back on the show. There's so many things I want to talk to you about. And I'm going to put my hand up because I would definitely like to do a deep dive on adult acne on a separate podcast with you. But today, I just want to thank you so much on sharing your insights on, this next generation of beauty consumer, aesthetic consumer, what we want versus what's available. And I guess, myth busting this idea that we're all really after diversity, because in a way we're kind of not.
No, true.
It was wonderful to speak to you.
Well, thanks for having me on. Yeah, really appreciate it.
Great to talk to you. See you soon.
Okay, bye.
I hope you enjoyed this episode. And if you did, please share and rate this episode. I'd love that.